So without further ado, we're going to move on to our next session, and our next session is going to focus on personalised medicine in action. So we're going to see some nice case studies of work that's underway in Ireland. But before I introduce the chair for this session, we're going to hear again from our public contributors. And the question we asked this time was, would you consider personalised medicine if it was an option for you? So here's what they had to say.
If personalized medicine was an option for me, it is something that I would consider. I have some older family members and friends who have been surprised by certain medical conditions that have arisen in their life and impacted on it, and trying to find ways to navigate and adjust to that. Some may have been preventable potentially, or may have been lessened if they'd gotten support sooner. And sometimes even knowing, sometimes when you're sick, not knowing is what's the worst thing. So, removing that not knowing, that uncertainty, by having, a personalized medical plan or approach, or knowing solutions that will help me as I get older, would be great. Would I consider it? Yes, I would. However, I would be keen to understand how my data would be used, or where my data would be used.
Like for me, my own personal experience, I would have had, for example, acid reflux. And I would have got scopes and saw the consultant, etc., etc. At no point did I ever get a specific diet to follow. Now I found that myself in my own research that would ease it, but I think, and like that, it's co-creation of my health along with the medical profession. But if I'm given the tools, I can co-create. But if I don't know the tools, it's very hard for me to take responsibility of what my part could be.
Yeah, well, I suppose that word preventative is so important, and it actually wasn't something that naturally came to mind when thinking what personalised medicine might be. I think in Ireland, and myself included, it's when you have a problem, we go to the doctor. And it's never actually trying to anticipate and maintain healthy lifestyles. It's only something that we kind of, think about our health when unfortunately it's slipping or it's below our standard.
Definitely, definitely. My biggest concern regarding my specific treatment, my antiretrovirus treatment, are the side effects, the damage that it might cause to my body. This is something that I think about. This is something that anyone who's under any type of treatment would think about. Medicine will be good and effective to treat something, but they will also have a down aspect. That's true for all medicine. So I would definitely be interested in finding a treatment that would be the least harmful in comparison to other treatments. That's definitely something that, of course, I would be interested in. If it means that in the long run I'm gonna be healthier.